Channel 4, the local station. This is Look Local.
Welcome to Look Local. I'm Karen Adams. This is the show where we feature 3 local businesses a week and tell you about local events that are going on around town. We do that by reminding you if you're looking for something to do or for someone to help, it is always better to look local. This week, we're featuring CNS Healthcare. We'll be discussing fibromyalgia, what it is, what causes it, what the symptoms are, and what you can do about it. We'll also feature the Jax Bridges program. It's part of the Jacksonville Chamber of Commerce and a one-of-a-kind program in the nation designed to help small businesses partner with larger ones. And then we'll look at one of those larger businesses, Ennis Pelham and Associates, a CPA firm, to see how they're sharing their knowledge with smaller companies in the area to help the community grow. But we begin today with Susan Angel. She is with CNS Healthcare, and today we're speaking about fibromyalgia. Welcome back, Susan. Good to have you.
Thanks for having me.
What is fibromyalgia?
Well, fibromyalgia is a disorder. It's characterized by widespread musculoskeletal pain, so lots of aches and pains, but also it's accompanied by sleep, mood, and memory issues, and just kind of an overwhelming sense of fatigue.
And what would cause this?
Well, you know, there are some presumptions about what may cause it. There are some genetic factors. There are issues related to maybe an infection or trauma, but really there's just, it's unknown. So oftentimes people will go through many doctors with these multiple symptoms, and oftentimes it takes a long time to finally get to a diagnosis. It's kind of like they rule things out, and then when nothing actually firms up, then they may come up with this diagnosis.
So how would they present?
Okay. Well, the ladies, oftentimes it affects ladies more than men. So a lot of the ladies coming in will often complain of aches and pains, and the pain is more than what you would normally think. So their pain sensation of something that may just be a discomfort to you or I.
Now that looks like it might be like in the head or the neck even.
Yeah, it can go head to toe.
Okay.
There's various pain symptoms that they can have, and they have to have pain present top and bottom, and they're often sensitive to painful stimuli more than the normal individual would. So yeah, so you see a lot of muscle tension and muscle tenderness. They also may complain of headache. They can also have stomach aches and pains. Sometimes irritable bowel syndrome is accompanied with it, as well as some depression and anxiety.
Really, it can actually cause depression and anxiety.
Yeah.
Some psychological issues as well.
And they kind of can feed into each other. And I would say the biggest thing that's a predictor of the pain and the overall impact is the lack of sleep. The sleep pain cycle is a really big issue.
I was reading here on one of the websites that people that do suffer from fibromyalgia oftentimes wake up tired in the morning as if they haven't gotten enough sleep from the night before.
Yeah, and the fatigue is perpetuating, and it affects their ability to carry out their activities of daily living. So you may, they may not function as well, you know, on the job, or they may have parenting impact, or just generally, you know, their household activities, whatever, can be impacted. And that's usually accompanied with the pain, and those interferences is when they'll seek out treatment.
And how is CNS Healthcare helping people seek out that treatment?
Well, you know, to treat the fibromyalgia, oftentimes they're treated for the pain or the neuropathic pain. They may also be treated with antidepressants. There's a couple of medications now on the market, Savella and Cymbalta. Both are indicated for fibromyalgia pain. Lyrica is also a nerve pain treatment that's indicated for fibromyalgia. But these medications for a lot of people may produce unwanted side effects. And so we're investigating a new medication that addresses the neuropathic pain, as well as affecting sleep regulation, that hopefully has less side effects than the current treatment on the market, with the same or better level of efficacy.
So if someone's watching this and they themselves are suffering from this, they can take part in your program. And tell us how it works.
Okay. We have a wide and varied clinical staff on board, and we're able to get patients in for an initial consultation where they can be seen by a nurse or a nurse practitioner, where they will evaluate their current level of symptomology, their medical history, current medications, and review the clinical trial. So we want to make sure it's something that is agreeable for them, and then again they're meeting the criteria for entry. And the one thing that's really good about it is, of course, if you participate, we don't require any health insurance. There's no out-of-pocket cost for the patients, and then we're able to assess and provide a full workup, and the patients would receive a medication and be evaluated on a weekly basis, and then we even offer a stipend for them, so we're able to compensate for their time and travel.
So when you actually are talking about a stipend, then you're actually offering them a monetary benefit for taking part in the clinical trial.
Correct, because we recognize your time away from your work or the gas it takes to get there, so they do receive some compensation.
If someone at home is listening to this and they suffer from this, can they just call you or get in touch with you over the website? And if they do have a primary care physician, should they let them know that they're going to be taking part in your study?
Oh, absolutely. They can call us or visit the website. Either way, they can make an appointment. And we oftentimes, if the patient allows, will communicate with the primary care doctor in terms of letting them know they're participating, as well as we often gain records and things from the primary care doctor so that we make sure that we have a complete picture of what's going on with the patient, but of course only if the patient agrees.
And quickly before we leave, tell us what a clinical trial is, just in case someone doesn't know.
I know it sounds kind of intimidating, but basically, our health care, the medications that we take all have to go through periods of assessment over time to determine they're safe and effective. And so our clinical trial is a mechanism by which we see whether or not a certain treatment is going to be of benefit in the condition that it's being evaluated for, and that the safety profile is positive.
That's right. And you guys are actually located, pretty centrally located.
We are. We're just off Belfort Road. If you're familiar with where Dave and Buster's is, we're just on the corner of Salisbury and Belfort, also on the bus route for those who utilize public transportation, and we're just off of JTB.
Excellent.
Yeah.
Susan Angel, CNS Healthcare, thanks again for coming in.
Thanks.
Appreciate it. Coming up next, the Jacksonville Chamber of Commerce has a one-of-a-kind program known as Jack's Bridges. Its focus is to help small business get off to a great start. We're going to speak about that. Plus, Winter Jam returns to Veterans Memorial Arena this Friday. And this year, favorites include Matthew West, King & Country, evangelist Tony Nolan, and many others. For tickets, all you have to do is log on to jmtour.com.